Do you know how sex works? What turns you on? What you need to get physically aroused? And what you need to reach an orgasm? And what the effect is of cancer and cancer treatment on all of this? Hi, I'm Nienke Dekkinga, a Dutch sex educator specialized in cancer-related sexual challenges. And in this video, I'm going to explain how sex works. And no, I'm not talking about the birds and the bees. And what is that effect of cancer and cancer treatment on sexual functioning? To explain how sex works, I'm going to use David Snarch's quantum model. I know this sounds a bit complicated, but trust me, it's actually quite simple. So, how does this model work? This model simply explains how you function sexually, what it takes to make your genitals work and reach an orgasm. The basic idea is that your body only reacts when you are stimulated enough. This is not as simple as it sounds. There's much more to it than some sensory stimuli and a little fantasy. This model works with two thresholds. The first one is the arousal threshold. You have to pass this threshold for your body to function sexually. And for women this means your vagina gets wet, your labia gets swollen, and a whole lot more. And the second one is an orgasm threshold. When your level of arousal exceeds your orgasm threshold, you experience your body's most pleasurable reflex, an orgasm. But what do we need to reach these thresholds? Well, there are three important base elements. The first one, the degree of sensitivity of your body to sexual stimuli. And we differ from each other in the way our bodies respond to sexual stimuli. You may have a higher threshold than me, or vice versa. Factors such as fatigue, stress, or alcohol can also temporarily raise the thresholds. Element number 2, sexual stimulation itself. Sexual stimulation can take place in different ways. Through the sense of touch, such as caressing, kissing, massage, and also through other senses, what you see, hear, or smell. And also exciting fantasies or memories can stimulate you sexually. And element number 3, your mental attitude, thoughts, feelings, and emotions you have about sexuality. And those thoughts, feelings, and emotions can either strengthen or weaken the degree of sensitivity of your body to stimuli and of your degree of arousal. But what are the possible effects of cancer or cancer treatment on this? When we go back to the first element, the degree of sensitivity of your body to sexual stimuli, well, this can be affected due to cancer or cancer treatment such as surgery, radiation therapy, or chemotherapy. Your thresholds may change as a direct result of damage to the brain, nerve, circulatory, or hormonal system. There can also be an indirect influence on the thresholds through factors of pain, fatigue, or poor condition. And those are well common amongst women with cancer. So, what can you do to improve the starting position of your body and thereby normalize the threshold values as much as possible? Well, first, improve your general condition. Fatigue is common in people with or who've had cancer, so get in the best shape you possibly can. And second, when you are in a lot of pain, you need to have good pain management. Pain is one of the big killjoys for sexuality. Here one should look for specific pain strategies. Think about pain medication or optimal timing of medication. And always do this in consultations with your doctor. You can also use heat application to painful areas before having sex, or take a hot shower or bath to relax your body. Physical therapy or psychological interventions can be needed at times. And for pain during sex due to a dry vagina, you can use a lubricant or hormone supplementation. But if your type of cancer is hormone sensitive, ask your oncologist if hormone supplementation is possible. And if you look at element number 2, the quality of sexual stimuli, your body can be damaged by your treatments and thereby raises your thresholds. If that's the case, you definitely need more effective stimuli to still achieve a reasonable sexual result. For example, if your nerves are damaged by surgery, you can opt for more visual stimuli or stronger stimuli, either manually or with some help of a vibrator, or stimuli aimed at other erogenous zones. Another thing is good mutual communication, and this is necessary to adapt to new physical sexual stimuli. Good communication also helps to rediscover each other's bodies, telling each other verbally or non-verbally what works well to get aroused and what works less well. And in our Western world, penetration sex is often the norm. But for most women, penetration sex is not the most pleasurable form of sex. Only 1 out of 3 women reach orgasm just with penetration sex alone. And especially when you have treatment of some kind in the genital area, don't forget to include oral sex or fingering into your sex repertoire. And maybe for you, that is the best way to have sex anyway. And last but not least, we have element number 3, your mental attitude towards sexuality. And maybe the most important one of all. With few stimuli, a positive attitude can sometimes give you just a little push to function well sexually. But a negative attitude can even undo ample stimuli and lead to dysfunction. What are the things you can do? Well, tackle the negative aspects of a negative attitude. Sometimes you first have to mourn for things that are no longer working, both in a general sense, but also in a sexual sense. And whether there's a change in sexual self-image or body image, because you gained weight due to treatment, or you've had a mastectomy or other scars on your body, a negative self-image inhibits sexual pleasure. So work on your self-image. For a lot of women, not the easiest thing to do, but the time and effort you put in is well spent. And second, introduce positive things. The positive aspects that can be exploited include thoughts and fantasies, a potentially rich source of sexual stimuli. Not your genital area is your biggest sex organ, as many still think. Your brain is. Expanding your erotic repertoire can make the experience more exciting and increase the chance of reaching your thresholds. Try to stretch your comfort zone and go on sexual exploration. If you find it difficult to do this right away with your partner, you can also explore solo to continue your journey of discovery with your partner at a later time. So, this is in a nutshell how sex works. If you like this video, click on the like button and subscribe to my channel if you want to see more videos. And if you have any questions about this topic or a related topic, drop a comment below and I'll be happy to answer.